Hi, good afternoon, and thank you for joining today's Insights Condition Information session. My name is Katie Crenshaw. I'm with Audacious Inquiry, and our team is here to provide technical assistance for today's session. If you need any technical support, please type your issue in the Q&A box, and one of our team members will assist you. Please be aware that today's session will be recorded. Closed captioning is available by clicking on the CC icon at the bottom of the screen. Any questions you may have during the presentation can be placed in the Q&A box and will be addressed during the presentation. Um, any remaining questions that we do not get to, we encourage you to submit to our feedback portal, which will be linked at the end of the presentation. Slides from today's session will also be made publicly available. As a reminder, the materials contained in this presentation are based on the provisions contained in 45 CFR Parts 170 and 171. While every effort has been made to ensure the accuracy of this restatement of these provisions, this presentation is not a legal document. The official program requirements are contained in the relevant laws and regulations. Please note that other federal, state, and local laws may also apply. This communication is produced and disseminated at U.S. taxpayer expense. Now I'm going to turn it over to Vaishali Patel with ASTP. She's going to get things started. So Vaishali, the floor is yours.
Great. Yeah, thanks, Katie. Hi, everybody. This is Vishali. I'm Deputy Director of our Technical Strategy and Analysis Division, and we are here to really get you all ready. I'm assuming it's primarily developers who are joining us today. So getting the developer community ready for insights. And, that's our goal for today, and also to provide some updates. So specifically, we are going to be providing an overview of the insights condition and maintenance of certification and submission requirements. This should be review for most of you, but we did want to go through this again for those who may not be aware of and knowledgeable about the insights condition. Then we'll be specifically going through a more recent update and an overview of the customers, the definition of customers, and updated certification companion guide guidance related to that. So that's like the most recent update, and then also sharing resources with you all. And Megan Gabriel, who is an economist within our division, will be providing an overview of the insights condition. And she is now leading much of the day-to-day related to insights. So I'm so thrilled to have roped her into this. So I'm going to be handing it off to her. Megan, take it away.
Thanks so much, Vishali. Appreciate it. So today we'll be providing an overview of, just like Vishali said, the insights condition and maintenance of certification requirements. We'll walk through just briefly, just for a recap, the intent behind the regulation, the reporting process, timelines, and the specific measure that's currently in place. Next slide, please. Thank you. So the insights condition builds directly on the foundation that was laid by the FHIR Act, which required the establishment of an EHR reporting program. So the goal is transparency, right? So transparent reporting, both to evaluate how certified health IT is performing, but also to give stakeholders more clarity on its use in real world settings. And insights helps to close important information gaps in the marketplace. It provides information into specific certified functionalities and also captures feedback about end user experiences. So put together, all of these elements really help to increase transparency, accountability, and ultimately, right, helps us to improve the tools that clinicians and patients rely on. Next slide, please. All right, so who is required to submit insights responses? So certified health IT developers must submit responses for the required measure or measures on an annual basis. And this can be done two ways. So either by submitting aggregated product level data with methodology and customer representation included, or by attesting that certain thresholds are not met. So for example, not having enough users or not supporting a particular technology. So in terms of maintenance of certification, these submissions must occur annually. So the first, and we'll go through this in detail, but the first data collection period begins January 1st, 2026, and the first reporting window opens up July 1st, 2027. So that's to give developers around 6 months to kind of prepare their data, et cetera. And here is a link for more information to the CCG that Vishali mentioned, and it's linked at the end of the presentation as well. Next slide, please. All right. So the reporting frequency, again, it's an annual reporting cycle. So data collection will run on a calendar year basis, so January 1st to December 31st. And developers will be given, again, 6 months to assemble and submit their results. So submissions will be due in July each and every year. So for example, in year one, developers will collect data across the full 2026 calendar year, so January to December. And in the first half of 2027, they'll assemble that data and then submit their reports or again, attestations in July. So at the same time, right, they'll begin collecting for year two measures. So this rolling process ensures a steady cycle of reporting and continuous, insights, for lack of a better word, for our stakeholders. And so again, for this year specifically, um, data will be due or attestations will be due July 2027. And the reporting period will be January 1st, 2026 through December 31st, 2026. And then the data assembly period would be January 1st, 2027 to June 30th, 2027. Next slide, please. So again, these responses need to be reported at the product level, so across versions, rather than on kind of a piecemeal basis. So developers with integrated certified health IT products, they only need to submit one response per metric. If a developer uses kind of relied upon software, they are still responsible for reporting, but they can work and coordinate with their vendor to meet those requirements. Another point I wanted to point out is the accessibility. So responses must be published with a publicly accessible hyperlink that allows anyone to view the information without any additional steps. This really is to ensure full transparency, and importantly, these responses will be publicly available on our ASTP website. Next slide, please. All right. So the submission process, we're working on designing it to be very straightforward. So we're leveraging and using the Certified Health IT Product List, or CHAPL. So developers will log in to the Insights submission system and have several options. It's expected to have several options for entering data. So we expect that developers can submit results directly into a web form through a portal. Either that, or they can use a CSV template or use a JSON template. And so we've tried to make these options flexible to really accommodate different workflows. And so there's our additional resources that we'll provide, such as eligibility checks, which will also be made available to help developers determine whether they're eligible for reporting, and then to guide them certainly through the process. Next slide, please. All right, so, and hopefully this is a review for all of us, but at this time, enforcement discretion applies. So certified health IT developers are not yet required to report on most insights measures, except for the measure on the use of FHIR in apps through certified health IT. We expect that developers will begin reporting on this measure again, like we talked about, in July 2027 for these year one metrics, and then in July 2028 for year two metrics. So for all other measures listed under the rule, enforcement discretion is being applied, and I'll talk about this later in more detail. But what this means is the bottom line is ASTP, we do not expect reporting at this time. So this phased approach is meant to help developers focus their resources on this critical use of FHIR and apps through certified health IT measure first. Next slide, please. All right. So this is a summary table to show which measures fall under enforcement discretion. So as you can see, most measures across domains such as individuals' access to EHI, clinical information exchange, and public health information exchange are not currently required. So the one exception is the one that's the big green check mark. So the use of FHIR and apps through certified health IT. This is the primary focus for reporting now. This provides, clarity to the developers about, where to concentrate compliance and technical efforts in the near term. And you can find the specifications for this on our website. And also we've linked to the specs throughout this slide deck and in the end as well. Next slide, please. So let's take a little bit of a closer look at the measure and the metrics for the use of FHIR and apps through certified health IT. As you can see in year one, developers will report on the number of certified health IT deployments where at least one FHIR resource is returned, broken down overall and by user type, and we'll go into more detail about user types later on. We'll also report on the number of requests and also on the number of deployments active during the reporting period. And then in year two, developers will add reporting on the number of deployments associated with at least one FHIR resource returned by a US core implementation guide version. And so these metrics kind of build over time to try to reflect both adoption and alignment with national implementation standards. And here is an example. Here are the links for both version 2 and version 4 of the specifications. And they're also available on our website. Next slide, please, Katie. All right, so there is flexibility in how developers can report this measure. So they must use at least the version of the insights measure specifications that were finalized in the HTI-1 final rule, which is version 2. However, you also have the option of reporting under version 4, which went into effect in January 2025. So version 4 expands on the definition of user type, and I'll go into that in further detail. But it includes a combined category of patient-facing and non-patient-facing endpoints. And the goal of that was to really ensure more precise reporting, as APIs expand in use. And again, this reporting applies only to the FHIR and apps measure, which is the sole measure under active enforcement at this time. And we've linked a fact sheet here below at the bottom of the screen if you'd like more detail. Next slide, please. And so this slide's really comparing the reporting requirements for the use of FHIR and apps through certified health IT measure under version 2 and version 4 of the insights measure specification. So most of the core metrics are consistent across both of the versions. So for example, reporting the number of certified health IT deployments that return at least one FHIR resource, whether they're overall patient-facing or non-patient-facing. And then the same applies to deployments that were active during the reporting period. So as you can see, what's new is the optional category in red. So developers have the option to report on deployments that serve both patient-facing and non-patient-facing users together. And this is really an attempt to give a more complete picture for APIs that are supporting multiple audiences. But again, it's not required. So in short, versions 2 and 4 are really aligned on the basics, but version 4 adds this optional flexibility to capture those kind of hybrid use cases. And that allows us, ASTP and other stakeholders, to really better understand that breadth of API use while still giving developers, right, a choice depending on your data availability. Next slide, please. Okay, so let's start with reviewing the first year one metric. And so this one is really focused on counting the number of certified health IT deployments that successfully return at least one FHIR resource. So the idea here is to measure how broadly FHIR-enabled deployments are being used across the marketplace. So developers will report this in two ways. So first is an overall count, and then the second broken down by user type. And the user type reporting is just super important, and it's also mutually exclusive. So deployments are categorized as either patient-facing, non-patient facing, or both. So patient-facing apps would be the ones that patients use directly to access their health information. Non-patient facing might include providers, payers, or researchers. And then there's an optional category for deployments that serve both groups. So again, by collecting this information, we, at ASTP really can get a clearer picture of who is actually using certified APIs and how widely those are deployed. Next slide, please, Katie. All right. And the second year one metric is to look at how many certified health IT deployments were actually active, and that's why we bolded and underlined it during the year. So here, active means that the deployment had a functioning FHIR endpoint available at any point in time, right, during that measurement period. And this helps to distinguish between deployments that may exist on paper versus those that are operational and available to support access to health information. So like the previous metric, reporting is done both in aggregate, so overall, and broken out by user type. So patient-facing, non-patient-facing, or the third optional category of both. And the user type categories, just like the first metric, are mutually exclusive to help prevent double counting and to give that clearer sense of the different types of users and how they're relying on certified APIs. So kind of taken together, right, with this first metric, this really helps us to understand the presence of FHIR-enabled deployments and then, of course, the actual use in the field. Next slide, please. And so the third metric for year one shifts from deployments to activity. So it captures the total number of API requests where at least one FHIR resource was returned. And this is reported by the type of FHIR resource. And they're listed here in that blue box. So this means that each request must have returned at least one valid resource, and developers will report these data by resource categories. So patient, medication, care plan, diagnostic report, so on. Optional categories include location, organization, practitioner, and practitioner role. And those also can be included. So this metric is meant to give real insight into which types of FHIR resources are being accessed most frequently across the deployment. So if patient resources are returned often, it may show heavy patient engagement. If diagnostic reports or medications are accessed frequently, that might highlight clinical use cases. So really, when you add them all together, these 3 year one metrics, so the deployments with at least one resource, deployments that were active during a year, and then the requests by resource type really provide this view of adoption and actual use patterns. In the Health IT Inquiry Portal, which is linked at the end of the presentation, we have received some questions. And we recognize that some developers may have successfully processed a request, but may not be able to kind of technically distinguish between responses that returned a resource from those that were successfully processed, but where no data were recorded. So one way developers could kind of verify the incidence of responses and to see where if no data is recorded, is kind of low, could be to take a random sample of requests to see those that were successfully processed and then examine how many of those did not have data recorded. And if you do this extra analysis, if this applies to you, please feel free to include the results of this analysis in your documentation, along with how the metric was operationalized. So the approach is transparent and clear. And you can find the questions related to this and our responses in the Health IT inquiry portal. But now I will hand it over to Vishali, who is going to walk us through that updated CCG guidance and provide us with some information on how to operationalize the percent of customers.
Great, thanks. Next slide, please. So, as you all know, developers must report on customers included in the data for each metric response for insights. Megan went through that in her overview. And we recently made an update to the CCG to provide clarification related to the definition of customer to be included for the calculation of the percentage of customers that needs to be reported, as well as other information related to the percentage of customers that will also be reported to for the insights condition. With regards to options for reporting on the customer definition, in the updated CCG, we have outlined 3 different options. One that's provider-based. So for an inpatient product, that might be number of hospitals. For an outpatient product, that might be number of clinicians. It can also be deployment-based. So in the case of the FHIR use metric, that could be a health IT deployment certified to the G10 criterion with a unique FHIR-based URL. Or it can be encounter-based, so looking at the number of encounters during a reporting year. We're hopeful that provides a range of options for developers that will accurately reflect your customer base. And so you all have to select one of these 3 options when determining and reporting on the percentage of customers that are included in the data, represented in the data. In addition to reporting the percentage of total customers represented in the data, developers also need to provide documentation that explains how the definition that's selected is operationalized, as well as reasons for customers not being included. So if your percentage of customers is below 100%, why is that? Is it because your customer's functionality was not enabled? Is it because your customer's systems were not updated to be able to report on this particular metric? Or was it because the customers declined to share their data? So we're looking to better understand the reasons why the percentage of customers might not be as high as it should be, and to better understand that. So, and I should also mention that the link to the updated CCG is also included in this slide, which will be shared with you all after the presentation. Next slide, please. So in terms of how to calculate this percentage of customers for each metric, we've tried to outline here some steps to go through. So first, for a given product during the reporting period, determine the definition of customer, whether that's provider-based, deployment-based, encounter-based, that will most accurately reflect your customer base. And I know depending on what data is available, and also how you've implemented the technology and what you can measure, it may be different for potentially different products that you have. So, given that reporting is at the product level, you do have the flexibility to choose for a given product what's the most appropriate definition. So in terms of the denominator for the FHIR use measures, it should include all customers with a product certified to the G10 criterion. And then in the numerator, the value should be customers with a product certified to G10 that are included in the particular metric that you're calculating. So in terms of calculating the percentage of customers represented in a given metric, the numerator should be customers with a product certified to G10 that are included in that given metric, and then the denominator should be, the customers with a product certified to G10. And in terms of what is expected that you'll be reporting on for each product, you'll be reporting on the percentage of customers included in each metric, and you'll be expected to provide documentation that where you let us know, what customer definition you've chosen and how it was operationalized within your system, and the reasons for excluding customers, such as the ones listed there that I mentioned earlier. And the percentages must be aggregated at the product level, because we're all reporting for insights is at the product level, as Megan had mentioned. Next slide, please. So I wanted to kind of go through each of the different definitions that we're offering, options that we're offering to developers in terms of reporting on customers. So generically, as I noted earlier, in the denominator, one would have the total number of customers with a product certified to G10 in the case of the FHIR use measures. And in the numerator, it would be the total number of customers with a product certified to G10 who are included in the data, so the subset that are included in the data. When we're applying that to using a customer definition based on providers, if you have a product that is an inpatient product, you may choose to select to report on the provider, if you're using the providers as your defined definition of customers, what you would do is in your denominator, you would take the total number of hospitals with an inpatient product certified to the G10 criterion. And then in the numerator, it would be the total number of hospitals with an inpatient product certified to G10 who are included in the data for that particular metric. And if you have an outpatient product and you're choosing to use the provider-based definition, what you could do is in the denominator, report on the total number of clinicians with an outpatient product certified to G10. And then in the numerator, report on the total number of clinicians with an outpatient product certified to G10 who are included in the data for that particular metric. So let's go through the next definition. So next slide, please. Okay, great. So if we're trying to calculate, the percentage of customers using the FHIR deployment-based definition, what we would do is in the denominator, you would be reporting on the total number of FHIR deployments associated with a product certified to G10 criterion. And then in the numerator, you would include the total number of FHIR deployments associated with products certified to G10 that are included in the data for that particular metric. And again, just as a reminder, the customer percentages should be reported for each metric. Next slide, please. So then the final option is the encounter-based definition. And when applying that in the denominator, you would include the total number of encounters within the reporting period, so over the past year, across all customers with a product certified to G10. And then in the numerator, it would be the total number of encounters within the past year across all customers with a product certified to G10 who are included in the data for that given metric. So those are the three options that you have. And, you know, I've tried to go through kind of generically how you would think about calculating the percentage of customers based on each of those definitions. And you'll have to apply it for each one of the metrics that would need to be reported that Megan explained previously. Next slide, please. So, so now we're kind of, that's like the meat of what we were planning to discuss today, but we also have, you know, a lot of other resources that, that will be helpful to you all, including, you know, next steps related to what you all should be thinking about and doing between now and January. Some frequently asked questions, as well as links to resources. Next slide, please. So in terms of what developers should do next, you know, I think that the most basic thing is determine whether you meet the reporting qualifications for the insights condition, the use of FHIR apps through Certified Health IT measure. So thinking about the criteria that Megan had gone through with you all earlier, you have at least 50 hospital sites or 500 clinician users across your certified health IT products. Does your particular product have a certified API? Is it certified to G10? Does that product have any users? So, you know, you need to answer each of those questions when thinking about whether you meet the reporting qualifications and whether you should be starting to collect data this coming January 2026. Additionally, think about the options for the specifications that Megan went through. Do you want to report using version 2 or version 4 of the measure specifications, and kind of going through that? Noting that the optional 4 only metrics are not required. Additionally, in terms of preparing for reporting, you have to begin collecting data as of January 1st, 2026, which is right around the corner. You know, please watch for updates that are coming soon related to the submission format and the templates. We'll be sharing announcements and, you know, providing explanations regarding those once those are made available. And finally, you know, understand your response obligations. You know, all certified health IT developers must submit a response, whether, you know, they have products that are eligible for reporting or not. You still need to, you know, submit a response. So if you determine you're not eligible, you still need to report a response indicating you're not eligible and why. And yeah, so next slide, please. I think I just went through that one, but, you know, just to reiterate, if the measures don't apply to you, you still must submit an attestation. In terms of enforcement discretion, does enforcement discretion mean I still need to collect the data but not report it? The answer is no. For measures other than the use of FHIR and apps through Certified Health IT measure, you do not need to collect or report data while that enforcement discretion is in effect. So the January 1st deadline for beginning data collection applies only to the FHIR use metric that we went over today earlier in the presentation. And another question, can I use the version 4 of the measure specifications for the FHIR use metric? Yes, you can use either version 2 or version 4. And when do I need to start collecting data? For required reporting as of July 1st, 2027, certified health IT developers need to begin collecting data, as I've noted, starting January 1st, 2026. Next slide, please. All right, so finally, here's a list of available resources to learn more about insights. I would recommend taking a look at all of these, and if you have any additional questions, you can also go to the Health IT Feedback and Inquiry portal and submit a question. Please use the ticket, the label or category for the ticket under Insights Condition, so it gets routed to the right set of folks, including Megan and myself. And let's see, I think we can go to the last slide, and I'm just taking a look at questions in the Q&A. Let's see, let me take a look at this. So I know Megan is answering one question, so I'll take a look at the next one.
I was about to respond, but I think that for the reporting requirements, I think the template's going to be very, very helpful for developers. And please do look forward to that in short order.
Response. Yeah, I think that might clarify that first question. For reporting the customer percentage, will we have to report 1% for each metric overall, or will we have to report the percentage for every single response included within the metric, such as reporting the percentage for each FHIR resource type in metric 2? The answer to that is, and maybe Megan, you should type this up just so we, because we collecting the responses and distributing them, is that the expectation is that you have to report the percentage for each individual metric, which is each single response. So like for each FHIR resource type, their percentage associated with that. And it may end up that the percentages end up being quite similar between the FHIR resources, but that's what's required. So the other question is, any attestation about doing this needed before January 1st, 2026? The answer to that is no. The attestation, if I understand your question correctly, the attestation happens at the same time one is submitting a response. So you're either submitting a response come July 2027, or you're submitting an attestation July 2027. So there's no need to submit an attestation before January 1st, 2026. You just need to, if you think that you are eligible for reporting, you need to start collecting data starting January 1st, 2026. Hi, Jeff. Thanks for your comment. So great webinar, very helpful. When will the data reported on the one measure be publicly available? Is there a timeline for ASTP ONC to reconsider when the other measures will no longer be covered by the enforcement discretion? So Jeff, we are hoping the data will be, publicly available shortly after the data is submitted. We have plans for a dashboard. We have a dashboard that we are in the process of developing to make that information publicly available. I don't want to say exactly when, it'll be available, because we'll probably want to do some quality control check before making data publicly available, but the plan is to make the data publicly available shortly after the data is submitted to ASTP ONC. In terms of a timeline to reconsider, I don't have a specific timeline for that as of yet, but stay tuned, Jeff. With regards to that, we'll be making information available related to that later on. Next question. If a client deployment upgrades to a version that then contains G10 in the second half of the data collection year, sorry, my screen moved. Where did that question go? Oh, okay. G10 in the second half of the collection year, do we count only from that point forward or exclude that client completely from the metric data collection for the entire year? So Megan, I feel like we've had a question similar to this that we got through the inquiry portal.
I agree. Yeah, I can, so we can follow up with that.
Yeah, follow up on that because I just want to make sure we're consistently responding on that. So let's put a bookmark on that one, and we'll be sure to respond to you. We have responded in the inquiry portal, so we'll just pull the answer to that and make sure that we're responding consistently.
And so for the definition of clinician, I think that's the next one. They said, is there a definition for clinician, for example? Is this any employee user of the EHR, only users that work directly with patients, or only specific types of users working with the patients, for example, doctors, but not nurses? And we do provide some guidance in the CCG related to the customer definitions, but the developers, when they're reporting, should just select the definition that really best reflects the percentage of customers included in the data. So whether that's provider deployment or otherwise.
Let's see. Is there additional guidance provided for when clients potentially leave mid-year and including data or excluding it? I also think we have related to that in the inquiry portal. I believe the response is you include all data. If a client leaves mid-year, you just include, let's say 6 months of data that they're there. But we will kind of confirm that by checking the inquiry portal. Let's see. And then last question here, is an insights question being added to the semi-annual attestation in April 2026? Semi-annual since the January 1st data period collection falls within the 6-month look-back period for that semi-annual submission, or not until that later date?
Yeah, insights isn't subject to the attestation condition. So it's annual submission.
Okay. Any other questions, folks? And if you think of a question later, just feel free, please reach out to us through the inquiry portal. Once the template that, we mentioned is available, we will plan, and, the eligibility check tool, we will definitely plan to meet again to kind of go through those. So this is not your last opportunity to kind of ask questions of us. So, so anyway, I hope this has been helpful. And I don't know, Megan, anything else that you would want to add?
No, and I think that these two questions that remain unanswered, we will, just get back to them, and the information related are currently in the inquiry portal. But yeah, these are great questions. Thank you all.
All right. Well, Vaishali, Megan, thank you so much for the information and leading the discussion. And thank you all for attending today. ASTP will post the slides and the recording on the healthit.gov website sometime in the near future. And as Vaishali and Megan mentioned, if you have further questions, feel free to submit them through our inquiry portal. Thank you and have a great rest of your day.